should a PA be any more restricted or limited than these other two healthcare providers in the same scenario and in the same situation? I don't think it's appropriate, and if we're going to do that, then I think, again, it's not the purview of this board. I understand that, I recognize that. But if that's what we're going to do to the PAs, then I think we need to look at statewide legislation to do it to all of them. Because the care is the same in the context of all three in that situation. Beyond that, in a rural community, these rural hospitals, after hours, don't even have anesthesia in-house. They don't have a surgery team in-house. We've got to call these people in. The room's 30 minutes. Again, you're putting an undue imposition on the PA and the supervising physician that doesn't apply, and it isn't appropriate when you consider the context of the entire scenario. We wait for teams to come in to do sections at night. I wish this board would maybe reconsider some of these thoughts. I don't think they've looked at it from a broader perspective. It is going to hurt healthcare in these communities, and you're going to see practices like mine that are going to wilt and go away, because when the PAs start going away, the physicians are going to go away as well. It's becoming near impossible to continue to do these services in these types of communities. So the very thing this is intended to help is going to be hurt with this kind of change. I respectfully appreciate the time to have made these comments. I hope that you all will consider some of the things that I've stated. I'll make one other brief point. There seems to be a tremendous opposition to mid-level, and I'm saying mid-level, all mid-level, in obstetrics and gynecology. They're blocked at the hospital level with credentialing because the physicians do not want the competition. They do not want to open up these procedures to non-physicians. I understand that concern, I understand that protectionism, but I do not necessarily agree with it. I happen to practice in a community, in an area, in a setting where it's inappropriate, but it's getting spilled over into these communities as well, and this board is actually facilitating that kind of change.
Thank you, Dr. Fulton. Dr. Ventrevia? Dr. Ventura?
Yes, sir. Good morning, Mr. President. I'm Hector Ventura. I'm a cardiologist, a heart failure specialist, a heart transplant specialist from the Oxford Clinic. And I represent also, I just had another title, which is the governor-elect of the American College of Cardiology in Louisiana. I'm not going to repeat what Lester mentioned about Oxford. We all understand the credentialing issue. I mean, and I think the PAs have been, for my profession, for what I do, have been very, very helpful. There are two words that I wanted to say. Number one is the issue about team approach. I think today the way medicine is, and we're talking about equity and healthcare access and so on, we need to understand that the team is important. The American College of Cardiology has a so-called cardiac care associates, which are the mid-level providers that are part of the society, part of the college, and they're very helpful in creating an environment in cardiology that will help us to take care of these patients. And the number two concept, which many mentioned too, is the issue about competence. I think I have another hat also. I do graduate medical education. I think competence is the key. I don't think we can restrict people that are in healthcare unless they be restricted by competence. If they don't know what to do something, they shouldn't be doing it. That will be for me. Every time I go to the bedside, when I have to do a procedure, I get to a computer to make sure that I can do it. I think it should be the same for anybody, at least in an institution, it is that way. And I think competence is the key. People can do swan guns. My PAs can do biopsies better than I can of the heart, I promise you. And if I have a problem, they will do it, and as well as do a balloon pump. They can do it as better than the fellows, I'll tell you that. So I think those are the things you have to think about when rules like this are part of the I understand the issue, but I think competence and team approach are important in medicine. And in the changes in healthcare, if we don't do that, I don't know how we're going to take care of these patients. It's going to be very difficult, not only in Louisiana, but in the United States. Thank you for your attention, and thank you for letting me talk.
Thank you, Doctor. Clark Gosse?
Good morning. Thanks for having me again. We'll be meeting often, I'm afraid, and it's our concern, as you know, that we're going to face a real crisis in Louisiana in the near term on the shortage of medical professionals. We recognize the importance of physicians' assistants to the healthcare workforce. We've submitted a letter earlier. As Louisiana moves to implement coordinated care networks, we recognize the shortage of family practice physicians necessary for the success of these coordinated care networks. Additionally, the Affordable Care Act offers both physicians' assistants and nurse practitioners, as well as physicians, the opportunity to administer the accountable care organizations. Physician assistants are an important provider of care in the rural and underserved areas of the state, especially in those areas, and also throughout the state of Louisiana. For these reasons, we have voiced our concerns in the previous letter. Since sending you a letter, we have received the Louisiana State Medical Society's offering, which we believe poses a potential reasonable compromise, and although not perfect, offers our members the opportunity to continue our reliance on physicians' assistants. Two additional concerns, however, we think need to be addressed. First, we believe that there must be some provision for emergency situations. The previous physician, the OB that we just testified, brings the point that I was just going to make about delivery situations where the emergency C-section is needed and necessary and has to happen. I can tell you, as you all know, I'm the chair of the Patients' Compensation Fund Oversight Board, and I see all of the cases that reach our level, and those emergency situations provide us with the most expensive cases that face medical malpractice in Louisiana, because we have the ongoing future medicals of these babies who, because of lack of oxygen, end up being lifelong care situations, and future medicals get to be a substantial part of their care, and they can live a long time. But if we can prevent that accident from happening in the beginning, then that kind of situation would be a lot less expensive, and the care and the life of that child would be a lot more gratifying. Secondly, we think that the amendment of the practice by merely posting the changes on your website be inadequate. Changes, whether adding to a list of services permitted or deleting, should be handled through the normal rulemaking process. Merely posting the changes leaves the physician's assistants, the physicians, and healthcare providers at risk of being caught unawares. I forgot to identify myself. I'm Clark Gosse, Louisiana Hospital Association, and look forward to your questions and our continued collaboration.
Thank you, Mr. Gosse.
Ms. Gosse, I think we've clarified the thing about the website. That was not the intent about just changing it overnight or whatever. I think the PA Association has read that totally wrong. That was not our intent. There's also the Board of Medical Examiners would never, ever sanction any physician, PA, or any other person that we license for doing the best they can in an emergency situation. We would never do that. I'll give you my word. But the issue is, this came about because the hospitals wanted to know, what can PAs do, what can PAs not do. So this came about because of the hospital, not the hospital association, but the hospitals. So we said, okay, we think this is a reasonable thing that a PA can do. And there's nothing on this list that would affect any PA in rural Louisiana. The only thing we have on this list are very invasive things that we don't think a PA should do. That's it. And I don't think your hospitals would allow some of the things that the PAs think we're accusing them of. Your hospital would never allow your thoracic surgeon to leave a PA closing a chest going 30 minutes away. They wouldn't allow it. So they're kind of blaming us for